The following is produced by 5 Star Productions USA, which is solely responsible for its editorial content.
What's the key to losing weight and keeping it off? How can you prepare a small child for major surgery? Are sexually transmitted diseases becoming an epidemic? Why are more businesses turning to employee drug testing? Can high technology get rid of unwanted hair once and for all? Important questions, vital topics. We'll address them all today on Today's Health. This presentation of Today's Health is sponsored in part by Health Labs of North America, Mallinckrodt, Oclassen Pharmaceuticals, American Biomedica, and Palomar Medical Technologies.
Sometimes it may seem as though Americans are obsessed with being thin, when what they really should be worried about is properly managing their weight. Being overweight can cause many health complications, but yo-yo dieting can be even more harmful. I'm Faith Daniels, and this is Today's Health. Getting weight off and keeping it off can be a real challenge, but with proper nutrition, it's a goal that can be achieved.
America has a serious weight problem. Medical experts have labeled obesity as an epidemic, and obesity-related diseases account for about 300,000 deaths a year, second only to heart disease statistics.
Obesity means being overweight, not just in poundage, but also in, it's relevant to body size and frame.
The key to treating obesity and preventing yo-yo dieting is nutrition, nutrition, nutrition. It's as simple as that. Exercise is important, but the real key is nutrition. Yo-yo dieting is losing the weight, gaining it back, losing the weight, gaining it back, and each time you go through that syndrome, that yo-yo, you are creating more stress upon every major organ system of the body, and therefore causing wear and tear on the body.
Most health experts agree that the key to any successful weight management program is a combination of a nutritionally balanced diet, the right amount of exercise, and behavioral changes that eliminate habits which tend to put on excess weight. Prescription programs designed by a doctor or nutritionist can be helpful, but they are not the only answers. Some non-prescription programs, like the Berry Trim Plus program, engineered by Health Laboratories of North America, can also help people achieve dramatic weight loss and keep it off. This program combines sophisticated superfood technology to provide full nutrition, even while reducing. This mixture provides an ongoing supplement that can deliver a full spectrum of nutrients, energizers, and digestants to support and balance the body chemistry while reducing or maintaining your weight goal.
Your appetite is decreased, but at the same time, you get a lot of nutrition, so you feel good. You feel comfortable, and it gives you a lot of energy, and that'll change your lifestyle.
And the bottom line to weight loss is, and always will be, calories in, calories out. Now, the problem has been, how do we do this without risking our health?
While taking weight off, the nutrition is combined in a program with the brindleberry, a natural appetite suppressant discovered in ancient China. The berry helps people resist the urge to overeat and can enhance fat burning.
You can imagine how important it is for a person in my business to maintain their health and their looks, but I mean, it's just as important for absolutely anybody to do that.
The key to successful weight management is taking the weight off and keeping it off.
Reducing the health risks associated with obesity and excess weight requires a comprehensive commitment to a more healthy diet, exercise, and other positive behaviors. But with that commitment comes the reward, and the rest of your life can be the best of your life.
They're small and may be frightened, but children can be prepared, so a major operation only causes minor stress. In the heat of passion, there's some cold reality: sexually transmitted diseases. Next on Today's Health.
The The thought of surgery and anesthesia makes most people go weak at the knees, but for a child, it can be even more frightening. An operation doesn't really have to be a terrifying ordeal for a young patient. Parents can eliminate much of the fear and anxiety with just a little pre-op preparation.
From the playground to the backyard, parents know a few bumps and bruises are unavoidable in the rough and tumble world of an active child. But what happens when your child needs more serious medical attention? For parents of a child facing surgery, the prospect can be daunting. Whether the surgery is routine or something more serious, anesthesia is a significant part of the procedure and a matter of importance to many. Understanding the part it plays can help ease anxieties and help parents be better prepared.
The anesthesiologist does a lot of things intraoperatively. We provide all sorts of support to make sure that this patient remains within the physiologic parameters that provide optimal care to that patient. I think every parent should be quite concerned about the type of anesthesia their child is going to receive. How is that anesthesia going to be administered? If we can inform the parent of a child or an infant of what's going to happen and how it's going to happen, I think we will have a much better parent.
Some key questions parents might ask are, how complicated is this procedure? What type of anesthesia will be used? How will the anesthesia be administered? What are the risks? What should I expect after the operation is over? Once the decision to have surgery has been made, a parent should begin preparing themselves and their child right away. Experts advise parents to be calm, confident, and as honest as possible when explaining medical procedures. Bringing a favorite toy to the hospital, taking a quick tour, and making sure your child is comfortable with the staff can also be helpful.
First of all, I prepared him by telling him not to be afraid. Also, the doctors talked to me about the surgery and told him what to expect.
When preparing children for anesthesia, parents should keep in mind there are three types: local, regional, and general. With local and regional, the patient is conscious and anesthesia is used to numb only a specific area. However, there are many surgical procedures that may require more extensive measures, such as general anesthesia.
So general anesthesia then is the anesthetic technique where the patient is totally asleep. We can administer it through inhalational agents, or we can inject intravenous agents. So an endotracheal tube is then vital for securing the airway, for administering anesthesia.
Breathing tubes or endotracheal tubes like this one from Mallinckrodt Critical Care Division help provide a secure airway for the patient. During the operation, the anesthesiologist uses various equipment and gauges to monitor the patient's breathing, heart rate, blood pressure, heart rhythm, and body temperature. While every medical procedure does have some risk, new technology and advanced medical equipment are helping anesthesiologists make surgery safer and more comfortable. Knowing what to expect can go a long way to ease both you and your child's mind.
Most people today are more aware than ever of the importance of maintaining good health. A balanced diet and proper exercise can help, but education is also important. Knowing how to help protect yourself from disease may also help you prevent it.
In the past decade, concern over health issues has transformed many of our professional and personal relationships. Today, staying physically fit means being well informed about all the health issues affecting our lives. For sexually active couples, it is especially critical. Practicing safe sex can not only help prevent the spread of AIDS, it can also lower the risk of other sexually transmitted diseases, or STDs. Though some progress has been made in prevention, the U.S. still has some of the highest rates of STDs, with an estimated 12 million new cases every year. One of the most common STDs is condyloma, or genital warts.
Condyloma are warts that occur on the genitals, and we call them anogenital warts, that are caused by a virus, that's the human papillomavirus, and it's sexually transmitted. Condyloma are easily detected by a fairly experienced healthcare provider. Condyloma, if it's untreated, can last for months or years. We also know that the incubation period can be very lengthy, anywhere from 4 weeks up to 12 months or more.
Experts estimate up to 1 million new cases are diagnosed every year. Often, HPV is discovered through routine checkups or pap smears. For those diagnosed with condyloma, coping with the physical and emotional impact can be difficult.
Well, I was completely shocked when the doctor told me. And then I felt, I freaked. I was scared. I felt stupid because I didn't know anything about it.
For people living with HPV, understanding the physical characteristics of the disease is important. Treatments destroy HPV-infected cells, but they may not completely eliminate the virus. As a result, patients may experience recurrences from time to time. Current physician-applied treatments include pedophyllin, trichloroacetic acid, cryosurgery, electrodesiccation, and interferon injections. These treatments require patients to undergo multiple visits with their physician. Prescription treatments are also available and can be applied by the patient in the privacy of their own home. Pedophylax was the first patient-applied treatment in the U.S. and has been available since 1991.
The patient-applied treatment was wonderful in a way because I felt that I had more control. Privacy makes you feel better, made me feel better. It's just between me and the disease. It's not between anyone else anymore.
Effective treatment is especially important for women. Some studies indicate a possible link between HPV and cervical cancer. Experts advise women with HPV to maintain routine pap smears. For those living with HPV, understanding the disease and its treatments can be a vital step towards coping with its physical and emotional challenges.
Drugs have invaded the workplace. It's costing U.S. business billions. But companies are fighting back, launching employee drug testing programs to make sure workers just say no. We'll give you the results next on Today's Health.
Drug abuse is a persistent problem in our society, and in the workplace it can be a formula for disaster. Between absenteeism, accidents, and product defects, employee drug abuse costs American companies more than $100 billion a year. But now, businesses are fighting back.
Illicit drug abuse is a menace to our society. This social cancer can infect our schools, our home, and even the workplace.
The economic impact of drug abuse on the job costs American businesses over $100 billion each year due to theft, absenteeism, product defects, and accidents. The social and personal damage caused is beyond calculation.
Over 81% of major American businesses have decided that they can no longer absorb the losses resulting from drug-impaired workers and have instituted programs of employee drug screening in order to ensure a drug-free workplace.
Drug abuse in the workplace is a serious problem, primarily from a safety issue. If somebody is operating a piece of equipment and they are under the influence of illicit drugs, this is going to impact their fellow workers. And could be a very dangerous situation. It's not solely the problem of the individual drug user because he could affect the safety of his coworkers. 71% of all people who use illicit drugs are employed.
In response to this disturbing trend, employee drug testing programs have nearly tripled since 1987. But traditional off-site drug testing requires workers to go to a lab and complete the test. This can be very expensive and can take up to a week to produce results. On-site screening can be a more effective solution, and innovative testing systems like American Biomedica's Rapid Drug Screen Kit could provide the first line of defense in the war against drugs in the workplace. This test allows a non-clinical person to simply dip the test strip into the specimen and receive the results in about 3 minutes with the same sensitivity as standard laboratory tests.
Over 80% of American companies now have some form of drug testing program in place. This may be a job applicant screening program where applicants are tested. This may be a random testing program for all employees. It may be a remote site program or a post-accident program, but it's becoming a standard operating procedure in American business.
Drug screening in the U.S. is now a $2.5 billion industry. Other countries have initiated similar screening programs as well. On-site rapid drug screening kits, like those American Biomedica is producing, can help save time and money and preserve safety conditions on the job. The war on drugs is being fought on many fronts. The battle has already taken a hefty toll in this country in both monetary and human suffering. Hopefully, new innovative weapons will help us continue the fight against drug abuse and reduce the pain and suffering it leaves behind.
If you're on the internet already or thinking about it, you'll be amazed at how much information there is concerning your health and well-being. For a good start, visit our Today's Health website at www.vstar.com. Since before the days of Cleopatra in ancient Egypt, people have been struggling against nature to improve their cosmetic appearance. One constant nemesis has been body and facial hair. Now some high technology may help us in this age-old battle.
It's like a bad joke nature plays on us. As we get older, we grow less hair where we want it and more hair where we don't want it. Since before the days when Cleopatra ruled the Nile with her beauty and charm, humans have considered smooth, hairless skin on many parts of the body to be more cosmetically pleasing and sexually attractive. Since then, we've been plucking, shaving, waxing, zapping, and trying many other creative techniques to get rid of unwanted hair. Many of those procedures are painful and time-consuming.
Under my arms was where I had hair that I really wanted to remove as quickly as possible. And I think the idea of having unwanted hair permanently removed in really a painless fashion was really very attractive to me.
You know, hair is a real cultural thing. Smooth bodies are in and hairy bodies are out.
Humans have always been creative in developing new ways to rid themselves of unwanted hair. So it should be no surprise to discover that modern-day high technology is giving us brand new weapons in the hair war. Advanced physics, chemistry, and biology have all been applied to the challenge, and devices like this epilaser developed by Palomar Medical Technologies are allowing dermatologists to use laser technology to remove unwanted hair once and for all.
With a laser, you have a light. You're hitting many hair follicles at the same time. It's gentle. So as far as that's concerned, I think a laser is much, much superior in speed and in safety than any other method.
Remember the wicked queen who said, "Mirror, mirror on the wall"? Well, she was certainly too vain for her own good. But most experts agree that how we perceive the way we look can have an important impact on our self-esteem. Now, high technology may help give us a boost.
The battle to remove unwanted hair has carried on for centuries across many cultures. Now high technology is giving us another option to zap those feisty follicles. But just how does a laser remove unwanted hair and stop it from growing?
A laser is basically a focused beam of light, and then you focus that beam of light onto the skin. The beam of light gets attracted by the melanin or by the pigment in the hair. It destroys each hair follicle without actually harming any of the surrounding areas. So it's focused and it works only in the hair itself.
The theory of how the laser process works can be easily understood by remembering that light colors reflect and dark colors absorb light. We all know how hot a black car can become on a blistering summer day. In the laser process, the ruby light pulse from the laser, which lasts for only 3 milliseconds, is absorbed by the dark color of the hair's pigment down deep in the follicle. The resulting heat destroys the follicle and delays the hair from growing again. On a laser device like the epilaser, there is an applicator to reduce the distance between the skin surface and the laser. This allows the laser energy to be delivered where it is most needed, while at the same time it keeps the patient's skin cool.
Patients that have waxed and patients that have had electrolysis tell me the same thing. It is much less painful. You feel like a tapping sensation or a slight burning sensation perhaps, although it's not really burning anything.
I did not experience any kind of pain whatsoever, and it was a very quick procedure too.
Everybody has hair follicles that are growing and hair follicles that are sleeping. The laser light works only in the growing hair follicles. After about a month, the hair follicles that were sleeping are going to wake up and start growing. So each time you do the laser treatment, you're going to be treating mainly the growing hair follicles. And that's why it takes several treatments to get all of the hair follicles as they come into the growth phase.
Although laser hair removal can be very effective for people with light skin, its effectiveness is still being researched for people with darker skin tones.
I think the treatment was incredibly successful. I was amazed that the area that was tested, where the laser was aimed at, the hair did not grow back. And I noticed that there's not the shade that you generally get when you've just waxed or when there's been any kind of razor. There's no shade at all, which was fantastic. I loved it.
They say that beauty is only skin deep, and it may be, but it's no secret that this is a society that values physical attractiveness. Not having hair on certain parts of the body is part of the look that fashion and popular culture has deemed attractive. If high technology can help us eliminate some of the pain and hassle out of looking the way we want, then a cosmetic procedure may help us feel better about ourselves and therefore contribute to our health and well-being.
We've all heard the expression, better safe than sorry, but have we taken it to heart? Each year, more than 20 million childhood injuries result in more deaths than all the childhood diseases combined. The challenge is clear. We have to work harder to protect our children from injury. I'm Faith Daniels. If you want more information about any of the topics we covered today, visit our website at www.vstar.com. And join us again next time as we get right to the heart of matters concerning your life on Today's Health.
This has been a presentation of 5 Star Productions USA, which is solely responsible for its editorial content.